Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone, or good afternoon. Let me introduce myself. My name is Alya Suci Ramadhani, student of Medical Laboratory Technology in Polkesyo, Yogyakarta. In this video, I would like to explain about my poster. I think everyone know about HIV or AIDS. In this occasion, I would like to explain about my poster, with the title is "We Can Fight HIV or AIDS." One of the serious threats to the survival of human life is HIV or AIDS. Based on the data from the Indonesian Ministry of Health in 2019, there were more than 50,000 cases of HIV infection in Indonesia. Of these, most common HIV cases were heterosexual, followed by male sex men or MSM, or homosexual, injection drugs user or IDUs, and sex worker. Due to the lack of education and understanding about HIV or AIDS, and complete the PKKMB task of Polkesyo Ministry of Health Yogyakarta 2022, I made a medical poster with the title "We Can Fight the HIV or AIDS" as a form of educational tool for people who are still unfamiliar about what is HIV is, the symptoms they are experiencing patients, and how we can prevent it. At the top of the poster, directly, I explain about what is HIV is. According from the CDC, HIV is human immunodeficiency virus. It's a virus that attacks the body immune system. If HIV is not treated, it can lead to AIDS or acute immunodeficiency syndrome. There is currently no effective cure. Once people get HIV, they have it for life. But with a proper medical care, HIV can be controlled. People with HIV who get effective HIV treatment can live long, healthy life and protect their partner. After knowing what HIV is, on the right side of the poster explain what symptoms are usually experienced by HIV sufferer. Namely, most people have flu-like symptoms with 2 to 4 weeks after infection. Symptoms may last for a few days or several weeks. Having the symptoms alone doesn't mean you have HIV. Other illness can cause similar symptoms. Some people have no symptoms at all. The only way to know if you have HIV is to get tested. Okay? So, how do you treat HIV? The following is a way of handling patients with HIV according to WHO or World Health Organization. HIV is fully preventable, effective anti-environment treatment or ART prevent HIV transmission from mother to child during pregnant, delivery and breastfeeding. Condoms prevent HIV and other sexual transmitted infection, and prophylaxis use antiretroviral medicine to prevent HIV. Male circumcision is recommended in high burden countries in Eastern and Southern Africa. HIV is treated with antiretroviral therapy consisting one of more medicine. ART does not cure HIV, but reduces its replication in the blood, thereby reducing the viral load to an undetectable level. ART enables people living with HIV to lead healthy and productive life. It also acts as an effective prevention, reducing the risk of transmission by 96%. ART must be taken daily for life. People can continue and safe and effective ART if they stick to their treatment. In cases where ART become ineffective due to the reason such as loss of contact with healthcare provider and lack of medicine, HIV drug resistant people need to switch to other drugs to protect their health. What is the difference between HIV and AIDS? The difference between HIV and AIDS is that HIV is a virus that weakens your immune system, and AIDS is a condition that can happen as a result of an HIV infection when your immune system is severely weakened. You cannot get AIDS if you are not infected with HIV, thanks to treatment that slow down the effect of the virus. Not everyone with HIV progresses to AIDS, but without treatment, almost all people living with HIV will advance to AIDS. And now, what does HIV do to a person? HIV infects white blood cells of your immune system called CD4 cell or helper T cell. It destroys CD4 cell cause your white blood cell count to drop. This leaves you with an immune system that cannot fight off infection, even those that would not normally make you sick. HIV initially makes you feel sick with a flu-like symptom that it can hide on your body for a long time without causing noticeable symptoms. During that time, it slowly destroys your T cell. When your T cell gets very low, or you begin to get certain illness that people with healthy immune system don't get, HIV has progressed to AIDS. AIDS can cause rapid weight loss, extremely tiredness, mouth or genital ulcers, fever, neck sweats, and skin discoloration. Other illness and cancer often happen in people living with AIDS and can cause additional symptoms. Another symptom that you will get infected by HIV is fever, chill, fatigue, sore throat, muscle ache, night sweats, rash, and swollen lymph nodes, mouth sore. HIV has three stages. Stage 1 is acute HIV. Some people get flu-like symptoms and some people get flu-like symptoms a month or two after they have been infected with HIV. These symptoms often go away within a week to a month. Stage 2, chronic stage or clinical, let's see. After the acute stage, you can have HIV for many years without feeling sick. It's important to know that you can still spread HIV to others, even you feel well. Stage 3. AIDS is the most serious stage of HIV infection. In this stage, HIV has severely weakens your immune system, and opportunistic infections are more likely to make you sick. Opportunity infections are one that someone with a healthy immune system could typically fight off. When HIV has offended to AIDS, this illness takes offense of your weakness immune system. You are more likely to get certainly cancer when you have AIDS. This cancer and opportunity infection together are called AIDS-defining illness. To be diagnosed with AIDS, you must be infected by HIV and have at least one of the following. Number 1. Fever than 200 CD4 cells per cubic millimeter of blood. And 2. An age-defining illness. And there is my explanation about my poster. Wassalamualaikum warahmatullahi wabarakatuh.